The social work department consists of many little units. You have social workers in the psychiatric unit. You have social workers that work in the clinical area. You have social workers that work on the medical area, right? Presently, there's a social work at oncology. There's a social work at nephrology. There is two social workers at the psychiatric clinic. You have three social workers at the medical block, and they cover the entire hospital. If you understand the healing process, medication work to a point. Um, the biopsychosocial component of the patient helps them to relax. You counsel them, you work with the families against all odds, and you make sure that all is well for them. Good. So, how the process work at Georgetown Hospital and the clinics? The patient comes to see the doctor. If the doctor realizes that the patient has a social need or he is disturbed in any way, they would refer that patient, or they would ask the social worker to see that patient. Outside of that, the social workers run the block or the wards on a daily basis or almost every day, but should be a daily basis. And you observe patients that need help. Well, there's a major challenge, especially at Georgetown Hospital. For some reason or the other, persons out there are now finding it the ideal thing to abandon the patients. Those seniors, there's a talk somewhere out there that the best place to leave your patient is at Georgetown Hospital where you can take care of them anymore. But we ask the persons desist from that. You can contact the PAMs, you can contact any elderly home, because in so doing, you actually leaves a burden and a strain on the Georgetown Public Hospital. We have patients for more than 6 months, 3 months, and that kind of stuff. It's ridiculous to hear your family tell you, look, I am not taking them back. Don't bring them here. And, who's to take care of them? And because of that, they just stay stuck with us. And on a sad note, some of them go home from right here and they die in despair. We also ask the general public to cooperate with us so that when they meet emergency, they give the right information that is needed and specific to the patient.
My role here as a social worker is basically to bridge the gap between medical or persons with medical issues or terminal illness and a way of aiding them to get the resources or advocate for them to get the resources that they need for recovery. I also help to link persons with various or network with various institutions or organizations in order for them to get the required help that is needed at that time. Yes, we do have many challenges, and most of it stems from not having sufficient resources, not only for ourselves, but those for the persons who are in need.
Happy social work day to all the social workers in Georgetown Public Hospital, those working so hard at the clinical area, at the health centers, and spread abroad. Those that are in the social work profession, the social workers at Georgetown Hospital say to you, happy social work day.